Hello, today I'd like to talk to you about arthritis and a lot of the misconceptions that people have about arthritis. A lot of times we watch television and we're told that we have a condition of arthritis and that you need to take a pill for it or take a prescription medication for it, but a lot of us don't really understand what arthritis is. So to break that down, let's start with the word arthritis itself. Arthro means joint and itis means inflammation. So we have inflammation of our joints, and arthritis can happen anywhere that you have a joint in your body, whether it's in your hands, feet, knees, and spine. Now, there are different forms of arthritis. Most of us know what's called degenerative arthritis, but we hear a lot about things like rheumatoid arthritis, which comes typically from autoimmune diseases. Now that's very different than the most general and common arthritis that most of us know, which is degenerative arthritis. So let's talk about autoimmune related or rheumatoid arthritis first. Now this is something that typically occurs because possibly a virus has attacked your body, sometimes due to vaccinations. So a lot of people don't realize that if they get vaccines, that there are a lot of viruses or attenuated viruses in there that can actually attack the body and allow the body to start breaking down. It is very common, for example, for patients who are in the military or people who are in the military to get multiple vaccines because they lose records. And because of that, it's a higher level of multiple sclerosis in Army children. They call them Army brats because they've been vaccinated so many times, because MS is related to the measles vaccine. Something a lot of people don't know about. So you can be very careful before you get your vaccines to know all the ins and outs of it. That being said, so let's talk back about arthritis itself. Autoimmune diseases, this is again where the body attacks itself. Rheumatoid arthritis is one of the most common that people know about, but you can also get it from scleroderma, a whole different slew of different autoimmune diseases that the body will start to attack itself and the joints will start to break down. Now, in those cases, most people do go to their medical doctor and they are tested in a blood test and they find out they have the rheumatoid factor in their blood. In that case, they usually will seek medical treatment for their autoimmune-based arthritis. One thing, though, that people should know that it is very important that if you do have arthritis due to an autoimmune disease or a rheumatoid-based one, that you should seek chiropractic care as well, because that'll help reduce the inflammatory response in the body. So you don't want to just rely on drugs, because what do we know about medication? Always has side effects. And the drugs that they put you on for this definitely are really hard and harsh on your liver and your kidneys. And of course, lots of people start to die earlier because of the drugs, the things that they're using to help reduce the effects of the arthritis. So if you seek chiropractic care as well as using those medications, I think you'll have a much better approach and may be able to reduce those medications. And don't forget diet as well, because if you're eating inflammatory foods, that'll cause you to have more problems. We won't talk about that today because you can spend hours just talking about the medications and side effects and the kind of foods you need to eat to help reduce that. So let's focus back on the main arthritis that I'm talking about today, which is degenerative arthritis. Very common, and like the word degenerative, it comes from wear and tear or destruction of how the body's functioning. So degenerative arthritis, people usually see it in their knuckles or in their feet or their hands, or people say that I have arthritis in my knees. And it usually comes from some form of excessive wear and tear or trauma to that area. So, for example, you may have an injury or an accident that may cause this problem, but more so and more often, it's repetitive stress injuries, things that we do on a daily basis. For example, working on a computer all day will cause a lot of stress to the hands and cause stress to the shoulders and the neck. So that's a very common repetitive stress injury. Things like sweeping or being a construction worker, continually doing the same repetitive motions will cause destruction of the joints. And people will say, well, I see that my fingers get bigger and they're starting to really get tight and they're not going to function correctly. So a lot of people will take drugs for that. Now, there are ways to prevent these problems. One, you need to diagnose and find out if you're doing things in your daily basis that are causing you to cause wear and tear. Now, also, some things you just can't avoid. If you go to work all day and you work on a computer, there's nothing you can do about that. Unless you quit your job or ready to retire, you're going to have to do that job. So the best way is to look at your ergonomics and the things that you're normally doing to maybe help with that. Now, very commonly we see degenerative arthritis in our spine as well, and realize that degeneration occurs because, again, as we said, the body's breaking down. So one thing I want to touch on is, why would degenerative arthritis start to affect your spine? And by the way, the name of that is degenerative disc disease. So it gives you a little representation of this whole process of your discs starting to wear down. So when we look at our spine, one thing I want you to notice is that you're supposed to have 3 curves in your spine. And these curves, when normal, should measure 43 degrees. So the cervical curve, or the curve in your neck, 43, the mid-back, 43, and the lumbar curve, 43 degrees. The reason 43 is so important is at 43 degrees, there's neutral pressure on those bones and discs, so they glide very nicely together. What happens is when you get something called a subluxation, or when a vertebra misaligns out of its normal position due to those excessive stresses that we were talking about, or repetitive stress injuries, the vertebra will misalign. And as that occurs, you start to cause loss of curvature. The curve will start to reduce as the vertebra subluxates backwards in the spine. When that occurs, those bones and discs are going to rub and grind together. So not only are you going to have nerve pressure from the subluxation itself, which can cause your body to shut down, pain, dysfunction, and deterioration, but you're also going to get chronic side effects of degeneration or arthritic changes on the spine. So the less curve you have, the more pressure there are on your bones and discs. Think of it like the alignment of your car being off track. So you knock the alignment off, what's going to happen to those tires and to those shocks? Well, they're going to wear down, aren't they? In the same sense, what's going to happen to the spine if that curvature or alignment's off? They're going to wear down as well. It's been proven that over 200 times the normal pressure on your bones and discs occurs when you have a subluxation, again, leading to that loss of curvature. So 43 degrees is the magic number, and that's what we want our spine to be, or as close to it as possible. Now, how do we diagnose that? Well, the best way possible is going to see your chiropractor to have a complete analysis of your spine. You should get a postural checkup. Just like you go to the dentist to make sure that your teeth are clean and in alignment, and if they're not, they send you to the orthodontist. Chiropractic, in the same sense, is the same as what an orthodontist does to the teeth. We look to make sure that your posture is in correct alignment so your body functions at the most optimal ability that it can. Very important, because if your spine is off track, if you have loss of that curvature or loss of that 43 degrees, what happens is your body's going to break down. And that can start as early as 20 years old, 15 years old, or 10 years old. In fact, in our office, we see lots of people who are like skateboarders, taking jumps and crashing onto the concrete from age 12 to age 18. By the time they're 20 years old, they have tons of degenerative disc disease or degenerative arthritis in their spine. Now, we also have patients that come to us who are 70, 80 years old and have minimal degeneration in their spine. So I want to make sure that you understand this has nothing to do with age. It has to do with wear and tear and the miles you put on your body. So the best thing you can do is make sure that you bring your family, your children, and get everyone checked out to make sure that their posture is in the most perfect alignment, as close to 43 degrees as possible. Find your local chiropractor, have someone analyze you, and make sure that you live a long, healthy life.